Long-term constipation may lead to fecal impaction, and this involves hard, dry stool being stuck in the child's rectum. This may be an emergency, so it is best that you know when is it normal and when is your child constipated. What are the signs that your child may be constipated? And what are the different causes of constipation? And what can you do at home to help your child and how to treat your child's constipation? We will talk about these things in this video. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Constipation in kids. Constipation is the bowel movement or pooping in kids, which are hard and dry stools that are difficult to pass. For some kids, it may be infrequent stooling as well. It causes discomfort and pain, although constipation may be just temporary. But if it's left untreated, it can lead to serious problems. So what is normal? Bowel movement patterns, or how often the child poops, varies from child to child, just like they do in adults. So what is true, what is normal for your child might be different in another child. Some children have 1 or 2 poops every day, while some kids have poop every 2 to 3 days, and it is just normal for them. Now, when is it constipated? These are the signs that your child might be constipated. When the child passes hard, painful stools, when there goes many days in between bowel movements, more than their usual, when you note that there is bleeding or blood in the poop, when you note that the child is now complaining of stomachache or cramping or nausea or vomiting, when there is soiling, wherein you note poopy marks in your child's underwear, and also if a child's bowel movement clogs up the toilet. So let your doctor know if there goes many days, more than 3 days that have passed between your child's bowel movement, or if your child has hard, painful stools. Sometimes, kids who have really bad constipation may have pooping that now looks like diarrhea. What happens is, when a child holds back his or her stool, the stool gets bigger and bigger, and this stretches the rectum. Some children lose the urge to go poop, and for some of these children, they don't poop unless they get treatment. When the pooping now becomes liquidy or has smears in the child's underwear, this is now known as Encopresis. You should let your doctor know about it because your child needs treatment. What causes constipation? One reason might be from stool withholding. Why might your child withhold his or her stool? Well, for some, it's because they have hard stool and they find it difficult to pass. Another reason might be children just don't want to stop playing, so they rather hold their stool. Another reason is for kids to show that they're in control. This is true for 2 to 5-year-olds. So, when you're toilet training your child, it is best not to push them when they're not ready. Another reason for older kids is that when they're in a new environment and they just don't want to use the public toilet, or they're afraid to do so, or they're away from home, such as in school or when they're camping. Another reason might be illness. If your child is sick and loses his or her appetite, it can lead to constipation. Or it might be a side effect from his or her medicines. Another cause might be diet. If your child is not eating enough fiber, or if your child is not drinking enough liquids. And any change in your child's routine. So it may be when you're traveling, or if the weather is hot, or in any stressful situation. All these may affect your child's overall health as well as his or her bowel function. How to treat constipation and how to help your child. But before we go to that, are you expecting a baby or you already have a newborn? How better life can be when things are under your control upon baby's arrival. When you know how to soothe a crying baby, you know how to give baby a bath, you know how to go about breastfeeding. When should you worry? Is baby sick? Well, if you want online training in the comfort of your home, check out the online training video series I've developed known as the 5 Newborn Care Strategies. Do check that out with the link provided in the description section. Constipation should be treated early on. This is because the longer the stool stays, the larger and drier it is going to get, and the more difficult it is to treat. There are no special tests needed to treat constipation, and treatment would depend on the age and how bad the problem is. For kids and teens, usually the doctor would prescribe medicine to soften and remove the stool. Do not use laxatives or enemas though before checking with your doctor. This is because if these are used the wrong way, it might lead to more problems. So once your child's constipation has been treated, once the hard stool has been removed, your doctor would teach your child how to develop good bowel habits. You can help your child develop good bowel habits. First is by having a routine. So set a regular time every day for your child to use the toilet. For example, right after breakfast. Also, you can put a stool so that it's easier for your child to push when pooping. What you can also do is to make sure that your child eats the recommended amounts of food from different food groups, and to eat lots of fiber, drink plenty of liquids, and encourage your child to play and be active. How to make sure that your child is getting enough fiber? Well, the magic number is 5. As long as your child is eating at least 5 servings of fruits and vegetables per day, then your child is eating enough fiber. Also make sure that your child eats other food sources from other food groups. Hey, if you like this video, watch my next video where I teach you about other child health problems.